Seminole Behavioral Healthcare knows how important it is to maintain an exemplary standard of service at all times and at all levels. But we also know success is never final. Our efforts and vision today determine outcomes that affect lives tomorrow. We have a myriad of innovations being used presently in the world of hands-on activity, the virtual world, plus many in development. Our team is committed to ensure continued innovative approaches throughout all operations. Innovations in the human services field are critical, now more than ever. With shrinking resources, innovations lead to increased efficiencies to help us remain relevant and solvent in a forward-thinking environment. A behavioral healthcare agency needs to stay on the cutting edge of new technologies and new processes to help support the corporate mission and continuously improve client care. We have worked closely together with the Seminole Sheriff's Department to implement Assisted Outpatient Treatment, AOT, on a limited basis. In 2004, the state revised the Baker Act law to include provisions for judicially ordered outpatient treatment for non-homicidal or suicidal residents. Since these revisions, Seminole Behavioral Healthcare has been responsible for working 85% of all Florida AOT cases, with great results from both clinical outcomes and bottom-line modalities. In 2010, Seminole Behavioral Healthcare was selected by the National Council for Community Behavioral Healthcare to be the only site in Florida, one of 10 sites in the nation, to participate in the Advancing Standards of Care study. The results of the study, presented in 2011 in Washington, demonstrated consistent and statistically significant increases in GAF scores. Seminole Behavioral Healthcare has become one of the two leading entities in providing services and training on evidence-based environmental strategies, such as bullying, throughout Seminole County public schools. Leveraging of pharmacy assistance programs often results in huge increases in Florida indigent drug program dollars from out-of-state pockets. We have aggressively expanded pharmacy assistance programs, bringing many more millions of dollars of medications into our central region. By engaging in bridge appointments, an additional step in the discharge process of inpatient clients, the goal of reducing recidivism can be achieved. Bridge appointments, a new practice, have been well received by clients and staff. They are normally performed by a licensed clinician who provides a solid linkage back to the community. Seminole Behavioral Healthcare was selected by the National Council for Community Behavioral Healthcare to be one of 6 sites in the nation to implement mental health first aid. This 12-hour course, analogous to first aid certification training, teaches laypersons how to recognize the signs and symptoms of a mental health crisis and be a first responder. Seminole Behavioral Healthcare developed online versions of the training aimed at veterans and their families and at clinicians who can earn CEUs. In 2011, we were selected by the National Council for Community Behavioral Healthcare as one of 21 agency members which are participants in a trauma-informed practices learning community. The learning community is committed to creating environments and services that address the needs of individuals who have experienced significant trauma. Although social media implementation is not new in the business and social realms, in the behavioral health domain there was some initial reluctance by providers nationwide to engage in social media activities, primarily over concerns of privacy relating to HIPAA and state statutes. After evaluating the issue and balancing the benefits and risks relating to social media's effect on our culture, Seminole Behavioral Healthcare is rapidly implementing these innovations to help connect with the community and potential clients, as well as reinforce ties with current and former clients. Seminole Behavioral Healthcare is exploring different ways to use telepsychiatry between our Sanford and Fern Park locations. Although traditionally utilized in remote areas, telemedicine and e-counseling show great promise as exciting innovations for our agency. We are implementing an innovation related to treating trauma. By providing trauma-informed care with eye movement desensitization reprocessing, or EMDR, trained licensed clinicians using this new therapeutic tool are expected to provide a more effective method of helping our clients with trauma issues. The development of our new mobile application, Lifeguard, will allow members of our service community to access help, advice, information, and outreach programs within the comfort of their own environment. Through an abbreviated diagnostic tool, the app quickly steers the user to additional information or perhaps access to care. Along with aiding in preliminary diagnostics, the app will then indicate the nearest facilities that specialize in the services that the user is interested in. Its features also include push notifications and share functions. Friends and family can even get involved by using the app, as it allows users to assess, explore, and connect. Seminole Behavioral Healthcare's innovations are continually improving systems of care and service delivery. Not only do our clients benefit from our innovations, but our taxpayers and funding sources do as well. Seminole Behavioral Healthcare remains firmly committed to continue the innovative thinking, design, and execution we have already put in motion, to keep us on the cutting edge in the years to come.